A dog had health insurance. I'm not joking. An actual dog was listed as a dependent on an employer's health plan, and nobody noticed. Not the enrollment system, not the insurance carrier, not the prior bin admin, not the employer in general. The dog sat the entire time as an eligible dependent on the health plan, sending to carrier unnoticed. And the dog wasn't the only surprise. We also found parents, ex-spouses, and other people who were not eligible for coverage. After we cleaned up the plan, the company's total cost came down by $2 million the following year. No benefits were cut. Employee premiums weren't increased. We simply made sure the people using the plan were actually supposed to be there. If you manage employee benefits or you've inherited a plan nobody has checked in years, this video is for you. I'm going to explain how this happens, why it may be costing your company, and the 5 steps you can take to start fixing it this week. I'm Erica Kirby. I've spent years managing employee benefits, cleaning up messy systems, and fixing the problems nobody warned you about when you first get the job. This channel is called Nobody Told Me That because benefits professionals are expected to know everything, even when nobody actually trained you. My goal is to make benefits easier to understand, easier to manage, and a lot less overwhelming. Now, let's talk about how somebody's golden retriever ends up with a health insurance card. If this is the type of information that you enjoy, I invite you to hit like and subscribe and get more tips and tricks like these. Okay, let's get into it. Point number 1, nobody told me the honor system isn't a system. At one company, dependent enrollment works like this. An employee typed in a name, the date of birth, selected dependent, and coverage started. Nobody asked for a birth certificate. Nobody asked for a marriage certificate. Nobody asked for any sort of secondary documentation. The system accepted whatever was entered. That sounds convenient until you realize the eligibility is now based on what employees believe, not what the plan document actually allows. One employee may believe a parent qualifies because the parent depends on them financially. Another may forget to remove an ex-spouse after a divorce, or they may be court ordered to continue to provide insurance coverage to said ex-spouse, and they believe that they can remain on our health plan. Someone else may think, my dog is my family. And honestly, I understand that logic. I have 2 furry babies and they are very much my family. But your medical plan does not cover golden retrievers. Most of these situations aren't part of some giant scheme. People misunderstood the rules. Life changes, divorces happen, children age out, employees forget to update their coverages. And when nobody checks, those dependents can remain on the plan for years, especially if your organization has never gone through any sort of dependent verification process. And if your company is great at holding on to talent, these beautiful individuals have been on your plan potentially for many, many, many years. Point 2, nobody told me how much one ineligible dependent can. Industry audits often find that roughly 3 to 10% of covered dependents are not actually eligible. The average annual cost for one covered dependent can run somewhere between $4,500 to $7,000 depending on the plan and the claims. Let's make that simple. Imagine your company covers 500 dependents. At the low end, 3% are ineligible. That's 15 people. If one costs the plan $5,000 per year, that is 15 times 5,000 equals $75,000 per year. That's a $75,000 cost of paying claims of people who shouldn't be on the plan. At 10%, you could be looking at 50 ineligible dependents. That's 50 times 5,000, which equals $250,000 per year. And that's before you consider a major surgery, an expensive prescription, a catastrophic claim. And the company where I ran this audit, the cleanup was worth $2 million the following year. When I saw the final number, it got everyone's attention because we hadn't taken anything away from eligible employees. We stopped paying for people who were never supposed to be covered. Before you cut a benefit, make sure you aren't paying for people who don't qualify for it. Point number 3, nobody told me the biggest risk may not be the monthly claims. The ongoing claims are expensive, but the bigger danger may show up when an eligible dependent has a very large claim. Let's say your company is a self-funded medical plan. A dependent who never qualified for coverage has $500,000 hospital claim. Your company submits that claim to the stop-loss carrier. The stop-loss carrier reviews the dependent's eligibility and determines that person should never have been covered. That reimbursement may be denied. Now, the employer may be responsible for the entire claim. That's also a compliance issue. Your plan document explains who is eligible. The employer has a responsibility to operate the plan according to those written rules. The employer has a responsibility to operate the plan according to those written rules. We never checked isn't a strong defense. And then there's the employee. Imagine finding out after a hospital stay that your dependent was never eligible. Claims could be denied, coverage could be canceled, the employee could receive bills they never expected. The kindest time to discover an eligibility issue is before the hospital visit, not after. The eligibility verification doesn't just protect the company, it protects the employee from a much worse surprise later on. Point number 4, nobody told me to begin the audit with grace. When people hear dependent eligibility audit, they picture HR turning into the police. This is not how I recommend starting. Begin with an amnesty window. Give the employee 2 to 4 weeks to voluntarily remove anyone who does not meet the plan's rules. I typically encourage doing this during open enrollment, especially if you're having an active enrollment. It allows for them to go ahead and clean up what they didn't know that they were inadvertently doing. No penalties, no embarrassing investigation, no note to the employee's files, just a clear message. We are reviewing dependent eligibility. Please review your current dependents and remove anyone who is no longer eligible or qualifies. A lot of ineligible dependents will come off the plan during this period. Most people weren't trying to commit fraud. They misunderstood the rules. They forgot about an old enrollment, or nobody told them they were required to report a change. It also makes the rest of the audit easier. Leading with grace protects the employee's trust. Assume confusion before you assume fraud. Point number 5, nobody told me one-time audit is not enough. The audit cleans up the past, but your process has to protect the future. Here is a 5-step process. Step 1, read your plan document. Do not rely on memory. Do not rely on how the company has always handled dependents. Don't rely on your prior knowledge. Read the documentation. Refresh yourself as often as possible and as necessary. Find the section that defines the eligible spouse, child, stepchild, disabled dependent, domestic partner, or other covered family members. That definition is your ruler. Everything gets measured against it. Step number 2, offer the amnesty window. Give employees a reasonable period to voluntarily remove ineligible dependents. Explain the purpose clearly. The goal is to make sure the plan is accurate, not to embarrass anyone, not to penalize anyone, not to punish anyone. The goal is to make sure our plan is accurate and all eligible dependents are captured. Step number 3, require documents. This may include a marriage certificate for spouse, a birth certificate or adoption record for children, court documents for guardianship. Sometimes it goes as far as tax transcripts to make sure that you are cohabitating together. No special exceptions for executives. Nothing will destroy trust faster than making employees provide documents while leadership gets to skip the process. We treat everyone fairly. We are all teammates. We do not endorse hierarchy. Step 4, set real deadlines. Tell employees exactly what is required. Tell them where to submit it. Send reminders. Explain what happens if the documents are not received. then follow through. A deadline with no consequences teaches everyone that deadline is optional. And it's not optional because your planned health is at stake. And step number 5, make verification permanent. Require documents during new hire enrollment. Require it after qualifying life events. Check newly added dependents during open enrollment. You may also perform occasional spot checks. Otherwise, you will clean up the plan today and have the same problem again 3 years from now. A one-time audit fixes the file. A permanent audit keeps the fix. So, now that we understand the importance of a dependent verification process and we understand the importance of follow through and the reasons why we need to do this, not to be the Grinch who stole benefits from its teammates, but to be the bin admin who protected the health and the integrity of the plan to keep it affordable for all. So what do we need to do this week? Here are your first 4 action steps. Number 1, read the dependent eligibility section of your plan document. I know after a while this can get a little bit boring, but it's good to know. So read the dependent eligibility section of your plan document. Not next quarter, this week. You need to know exactly who your plan says can be covered. This is very important as well if your plan only covers legally married spouses versus legal domestic partnership. Number 2, pull a dependent census from your benefits administration system. Look for obvious problems. Children over the age limit. Unfortunately, there are some bin admins that are not great at catching when dependents turn 26. They're the easiest to go and look at. Check for duplicate dependents. Missing dates of birth. These are very easy, especially for newborns. Unusual relationships. Ex-spouses who may still be listed. Just remember, when you are looking through your dependent data, you are not making decisions yet. You are simply seeing what is actually in the system. Number 3, talk to your broker or benefits counsel. Ask what a document-based dependent verification audit would look like for your employee population. Also, ask your broker to review the eligibility language for your stop-loss contract. Number 4, create an ongoing verification role. Decide when document verification is required, who will review them, where they will be stored, and how employees will be notified when information is missing. Do not wait until the next audit to create the process. Okay, let's recap. Here are the 5 things nobody told me about dependent eligibility audits. The honor system isn't a system. If nobody checks the documents, your eligibility is based off of assumptions. Number 2, one dependent can cost thousands. Ineligible dependents can cost the plan thousands of dollars per year. Number 3, large claims create large risk. A stop-loss carrier may deny a major claim for someone who was never eligible to be on the plan. Number 4, lead with grace. Start with the amnesty window because most problems are misunderstandings. Number 5, make verification permanent. A one-time audit cleans up the file, it cleans up your plan in that moment. Ongoing verification keeps it clean. So, what we learned is that a dog had health insurance and nobody noticed. So what could be sitting inside your health benefits system right now? I created a post-open enrollment audit field guide and tracker to help you review what is actually in our system step by step. A dog had health insurance and nobody noticed. So what could be sitting inside your bin admin that you have no clue about? These are the types of situations that caused me to create a post-open enrollment audit field guide that helps you trace the roots. You will find the golden retrievers, you will find the aunties and the uncles and the moms and the dads, the brothers and the sisters that should not be on the plan. You will keep the integrity of your plan. I highly encourage you to head over to ericakirby.com and see if this OE tracker and audit resource field guide will be of use to you. And while you're there, join the Hive, my weekly email for benefits professionals who are trying to do this job without losing their minds. A dog had health insurance and nobody noticed. So what could be sitting in your benefit system right now? I created a free post-open enrollment audit field guide and tracker to help you review what is actually in your system step by step. I'll also put the direct link in the description below. No corporate fluff, just plain English help you can actually use. Just plain English help you can actually use. A dependent eligibility audit may sound like HR playing detective, but checking eligibility isn't about policing your employees, it's about protecting them. Every dollar spent covering someone who doesn't qualify eventually shows up somewhere else in higher premiums, a worse renewal, a benefits the company can no longer afford. Fixing the eligibility file lets you protect the benefits meant for the people who actually qualify for them. Next week, we'll talk about another benefits problem nobody warned you about that's hiding in your system. Until then, remember, benefits are of use to us all. Remember, you are called and you are special just as you are. I thank you for taking the time to come visit me. Make sure that you hit like and subscribe, and I will see you next week.